Hello, my name is Kristen Zelakevich. I am from Nursing 612. Today we'll be discussing a hematologic disorder called Polycythemia Vera. We will go through each slide, and by the end you should have somewhat of an understanding of polycythemia. And thank you for listening, and I hope you enjoy the slides. So to get a better understanding of how polycythemia would present in an emergent situation, we will be discussing this patient on this slide. His name is Christopher Scott. He is a 63-year-old male. He presents in the emergency department. He is complaining of shortness of breath, mostly when he's lying flat. He is very fatigued and weak. He does have some bilateral bruising on his arms and legs. His face appeared flush, and he did report that it felt warm with numbness and tingling in his fingers. He does have a history, he stated, of headaches, of nosebleeds, and hypertension. So these are very prominent signs and symptoms that we'll be discussing further as we go through the slides. So it was a good idea for Mr. Scott to go to the emergency room. Polycythemia vera, these signs and symptoms occur because of these excess red blood cells that are circulating through the body. These red blood cells are abnormally produced in the bone marrow. So often they present with several of these signs and symptoms. It is important for patients to go to the emergency room, whether it's an acute attack or a chronic attack, because it can cause different issues medically. Polycythemia is a genetic disorder. It is a mutation on the code of the Janus kinase 2 protein. It is an abnormality, as we had discussed in the previous slide, in the bone marrow. As it produces more of these red blood cells, it can become very dangerous and life-threatening without being treated. It can cause thickness in your blood and slows the flow of your blood down, which causes serious conditions and including blood clots. PV is usually most common in men like Mr. Scott, as we discussed in our scenario. Men over the age of 60 are most commonly diagnosed with PV, although you do see it in children very rarely, and in women a little more than children. To be able to diagnose, they would be diagnosed the same way with a blood test. There is one difference with children when they have PV. They're not as symptomatic, so it's a little hard to diagnose. So they would go through similar testing and treatments as adults do. The first diagnosis for PV would be a blood test to check red blood cells and white blood cell count. They both would be increased with PV. So the hemoglobin would be increased, hematocrit would be increased, and right here gives the breakdown of men and women. And also white blood cell count is increased, as well as the platelets. Now the serum erythropoietin is low in PV, so that would be, if you see the higher red blood cell, white blood cell count with the low serum, then those would be two indicators of PV. Other diagnostics would be, of course, a history and physical. The provider will be able to get an in-depth medical history to see if they have a history of any of the symptoms, such as the overall health of the patient, the previous sickness of the patient, and maybe a change in symptoms, possibly, and of course a full physical exam, and they would be looking for different indicators for PV in the physical exam. Both of these are great ways to break down the signs and the symptoms of PV. Also, if they are thinking that it is PV, a bone marrow biopsy and aspiration would be involved, where they would take a sample, and then of course at the same time they would aspirate the bone marrow as well. These will help to be able to be tested in the lab to find out. Other diagnostics can be MRIs, abdominal CTs, or bone scans. These can help to diagnose things that are problematic, such as an enlarged spleen with a CT. Bone scans might be done due to bone pain to rule out any advancement in the disease. And also MRIs are always good tools for diagnostic testing. So these you might see the provider might order as secondary or ruling other things out as well. The most common treatment for Polycythemia vera is having frequent blood withdrawals. Using a needle in a vein phlebotomy. This is the same procedure that you would do if you were donating blood. It decreases your blood volume and reduces the number of excess blood cells. So depending on how severe your condition is, the more you would have to do it. And at first, it's possibly done maybe once a week, but eventually you will not have to have these blood withdrawals as often. Also, antihistamines are used for itching or any other discomfort. It relieves any type of ultraviolet light treatment. Also, medications that are normally used to treat depression might be used, like selective serotonin reuptake inhibitors, SSRIs. These also can relieve itching as well. So these are two. Phlebotomy is probably a standard treatment. Antihistamines is more of a secondary treatment to reactions that you might have during treatments. If phlebotomy does not work for PV or it still needs further treatment, your doctor may suggest medications that can help reduce the number of blood cells. Some of this would be ruxolitinib. It has been a proven treatment for PV. Its recommended dosages would be 10 milligrams twice a day. Also low-dose aspirin, which actually will help some of the thrombotic events. And this would just be low dose, 81 milligrams, taking this one time a day. The other two might not be used as much. The hydroxyurea, it helps to reduce some of the symptoms of sores or ulcers. This would be a 500 milligram 2 times daily, with the max being 2,000 milligrams. And interferon, which reduces symptoms as well. And it also can help with hepatic and renal impairments. And this would be a 10 milligram dose twice a day as well. There are some non-pharmacological treatments for PV. On this slide, we'll discuss a few of them: exercise, avoiding tobacco, watching for sores and paying attention to your skin, and keeping away from extreme temperatures. So exercise, it helps keep the flow of your blood moving to decrease the risk of blood clots. It's recommended that stretching is done to keep your circulation moving. And as always, avoiding tobacco. Tobacco can increase your risk of heart attack or stroke. So just minimizing that increased risk with PV. And watching for sores. This would be similar to like a diabetic. So making sure that you inspect your feet regularly and that people with PV call their doctors if they have any problematic sores that look suspicious. And keeping away from the extreme temperatures. Just the poor blood flow increases the risk for this. So making sure that you're dressing for the elements or keeping warm when it's cold out, and just to hydrate yourself on hot days. So as with every disease, we discuss how it affects cultures. PV typically is more saturated throughout all cultures, although it is more frequently seen among Jewish patients of Eastern European descent. So, although they are seen throughout all races and ethnicities, PV can be more prominent in those patients. And as we discussed before, males are more apt to get PV than females, and it basically is saying that the ratio is 2 to 1. So with this in mind, it is always important for nurses to be culturally competent. So if we do have a patient that is from a different culture, different beliefs, it's always important for the nurse to assess the needs of the family and identify treatment plans according to what the family identifies to and what impacts their environment or their availability of intervention. So it's always important for cultural competency as we provide care for different cultures. As discussed earlier, PV has no cure, and it can lower a person's life expectancy due to complications. It's important to get treatment right away and follow the treatment plan that your provider has laid out for you, or what is expected of you. If the patient is treated, then they can have an increase in their life expectancy for 10 plus years. And if it is not treated and they are symptomatic, the life expectancy can be as little as 6 to 18 months. So it is important for you to be monitored to reduce those complications. And there are many complications of PV. This can be including blood clots, heart conditions, brain conditions, and of course pulmonary conditions. PV is fatal and it should not be treated lightly. Here is a list of my references. I hope that you enjoyed this information and that it was helpful for your learning. Thank you very much.